The following program does not offer personal medical advice. Please consult your doctor before using any treatment or product we cover. Welcome to Go to Health Media with your host, Jonathan Marks. We provide a welcoming environment where experts educate you on important health topics, answer your questions, and provide information from which you can benefit in consultation with your doctor. You can visit and subscribe to the show at gotohealthmedia.com. And now, here is Jonathan Marks. Hey everyone, this is Jonathan Marks. Welcome back to another show of Go to Health. Remember, you can subscribe to us at gotohealthmedia.com. You can watch us on YouTube, and you can listen to us on 8 podcast networks. So, today's show. Giving a baby a healthy start to life begins with a healthy pregnancy and a safe birth. However, a new report from Georgetown University's Center for Children and Families, that's CCF, says Congress could make that far more difficult for people living in rural areas if it moves forward with plans to cut Medicaid, which covers more than 47% of all births in rural America and 40% in metro areas. Those are huge numbers if Medicaid is cut back. Medicaid is a vital source of health insurance for women of childbearing age and is even more important to those living in rural areas. It's also critical to the survival of rural hospitals that provide care to pregnant women and their newborns. Congress is considering major cuts to Medicaid. Maternal and newborn health care in rural communities is already at risk, and these large cuts would likely make it more difficult for people to start their families in these areas. Medicaid cuts could lead to more people becoming uninsured and unable to pay their bills. Rural hospitals would be hit the hardest, potentially being forced to cut essential services like obstetrics or shut their doors entirely. These cuts would likely impact everyone living in rural areas, especially those who are pregnant and need consistent care and access to labor and delivery rooms. Joan Alker is the executive director and co-founder of the Center for Children and Families, that's CCF, and a research professor at the Georgetown University McCourt School of Public Policy. She is a nationally recognized expert on Medicaid and the Children's Health Insurance Program, or CHIP, and is the lead author of CCF's annual report on children's health care coverage trends. You can learn more about all this at ccf.georgetown.edu. That's CCF as in Frank, ccf.georgetown.edu. So welcome to the show, Joan Alker. How are you today?
Doing well. How are you?
Good. Thank you for being here. So tell us, what are the overall findings of your recent study?
So we looked at the role that Medicaid plays as a health insurer for women of childbearing age who are living in rural areas and small towns across the United States. So we're talking here about women age 19 through 44 and communities that have urban areas of fewer than 50,000 people.
Mm-hmm.
And what we found is that Medicaid is an important source for women of childbearing age across the country, but it's even more important in rural areas. So generally across the country, and it should be noted that these numbers are actually very conservative because this is kind of a point in time. About 1 in 5 women of childbearing age is covered through Medicaid. But in rural areas, it's closer to 1 in 4. It's over 23%.
Wow, that's a lot. Can you give us an overview so that people understand more? What's the state of healthcare in rural areas, and how is it different from urban areas? Tell us about that.
Yeah, great question. So in general, rural areas are really struggling to access the healthcare that they need. And that's actually one reason we did this report, because we know there are provider shortages in rural areas. Of course, there are transportation barriers. Sometimes folks have to drive long distances to get the healthcare they need. And we've seen a lot of rural hospitals closing because of financial pressures. And more importantly, some of the research that we reviewed for this report is has really found that labor and delivery units in particular have been closing. Even if a hospital stays open, they've been closing that
Hmm.
book of business because it's not financially viable with a low volume of births. And in fact, one study found that as of a couple of years ago, the majority of rural hospitals, 52%, don't have OB services or labor and delivery units.
Wow. So people have to travel maybe hundreds of miles to get that kind of care.
Very far. And, this is a huge issue for maternal and infant health.
Yes.
Of course, we have very great challenges in this country about maternal mortality. And we know, unfortunately, that moms and babies who are further away living in rural areas tend to have worse outcomes than those
Mhm.
that live in metro areas.
So let me ask a question about federal funding. So currently, the federal government provides, let's say, open-ended funding to the states for healthcare, and the new administration, as recommended in Project 2025, would restrict this funding by moving to block grants. Can you explain what this means?
Yes, and I should say, right as we speak, Congress is moving forward on proposals to cut Medicaid. The proposal you mentioned, the block grant, is not on the table right now.
Okay.
That would change the financing structure of Medicaid and ending essentially the guarantee of federal funding that's existed for 60 years now. But what Congress is doing is they are targeting Medicaid for the largest cut in Medicaid's history. The Nonpartisan Congressional Budget Office scored the bill that's moving literally this week at over $625 billion of Medicaid cuts.
Cuts.
That
Wow.
is cuts, yes. And that is sort of I've been working on Medicaid for quite a while now, 25 years. That is certainly the largest cut to Medicaid that I've ever seen. And also in terms of putting together this big bill, quote, the big beautiful bill they're putting together to advance President Trump's immigration and tax agenda, Medicaid is the number one place they're looking to make cuts to finance those tax cuts on his immigration agenda.
Now, can states afford these cuts from the federal government? I mean, what options do they have? Will they raise taxes? Will they cut services? What will happen to healthcare? How will healthcare be affected with these cuts?
Yeah, that's a great question because Medicaid is a joint federal state program and states actually run Medicaid. So they put in their share, they draw down the federal dollars. And what this puts states in a very bad spot, and governors will really be left holding the bag here with these cuts. Because folks' healthcare needs aren't going to go away just because Congress cuts Medicaid. So states will have very bad choices. They will either have to raise taxes, which, by the way, the bill actually restricts the way they can do that. So that makes
Mm,
it even harder for states. People will lose coverage, and indeed, the Nonpartisan Congressional Budget Office estimates about 8 million plus people will lose their Medicaid coverage under this bill, and that we will see 7.6 million more uninsured people. So those folks are still going to be there, and states again have very bad choices. They can raise taxes, they can cut Medicaid, or they can cut other areas of their state budget. And I'll say, for example, K-12 education, that's usually the biggest item in a state's budget. So no good choices here for states.
hmm And forgive me for asking, but I understand red states have lower incomes in general than blue states. So these Medicaid cuts will affect red states more severely. Is that correct?
Well, the cuts are going to affect states that have done the Medicaid expansion, which is 40 states plus DC, more than states that have not. But states that have not done the Medicaid expansion are also going to take a hit as well. But I think relevant to your point, Jonathan, rural areas, which I believe if you look at their voting patterns, were more likely to vote for President Trump, are going to take a harder hit in this
Yes.
bill in all states that have rural areas because rural areas, as this data finds and other research that we've done, are more reliant on Medicaid for insurance coverage than metro areas. So
Hmm.
this may be counterintuitive to some folks. Some folks might not be aware of this, but particularly because rural communities are already struggling and have these rural hospital closures, these labor and delivery units that are going away. It doesn't matter honestly what your coverage source. You can have employer sponsored coverage in a rural area, but if you don't have anywhere to deliver your baby safely,
Hmm.
that community cannot grow and thrive. So rural communities have a great deal at stake in this discussion where Congress is moving forward right now.
And the record keeping, I mean, if there are bad outcomes for women due to these cuts, will the record keeping be existent? Will it be at the state level or will it be kept at the federal level? How will we know the effects of these cutbacks?
Yeah, I mean, there's going to be these cuts are some of them take place right upon enactment of the bill, which of course they're trying for this summer. Some of them are going to happen in a few years down the road. So this is going to be a rolling kind of situation, and it's going to be very important to document. I would say that certainly Congress is moving forward. They're going to pass something for
Hmm.
sure this summer. But what the Medicaid cuts actually look like and how much they are at the end of the day, I think we don't know that yet. There has been significant pushback on these cuts within the Republican Party. There have been the president's own pollster has told him that MAGA voters don't want these cuts.
Hmm.
And even Steve Bannon has said that MAGA folks rely on Medicaid for their insurance. So there's a lot of internal division within the Republican Party about these cuts. So we'll have to see where they land. And then, of course, like I say, track what happens as they start to be implemented.
So if you want to learn more, you can go to our website. Let me give you the URL. It's CCF, that's CCF as in Frank, georgetown.edu, and the CCF stands for the Center for Children and Families. Joan, what other question haven't I asked that I should ask before we end this interview? What's the message you'd like to get out to people?
Yeah, I think one really important message is that Medicaid is critical for women of reproductive age across the country in both states that have and have not expanded Medicaid under the Affordable Care Act. But those states that have expanded Medicaid under the Affordable Care Act are really represented in the top 10 states that we found, and I'll just mention them. The top 10 states that have the highest share of women of
Hmm.
childbearing age covered by Medicaid in rural areas are New Mexico, Louisiana, Kentucky, West Virginia, Arizona, Oregon, Montana, Maine, New York, and Arkansas. And a lot of the cuts that Congress is considering, a lot of them are targeted at that expansion group.
Hmm.
And there's been virtually no conversation about how this is going to affect women of childbearing age.
And just explain for us before we leave, why is it that so many women of childbearing age are reliant on Medicaid? What is it about their income situations that makes them have to rely on Medicaid?
Yeah, so first of all, one of the reasons we see a higher reliance on Medicaid in rural areas in general for children and adults is because rural areas have less money. They're not doing as well as metro areas. So incomes are lower, and that means more people are eligible for Medicaid. And all states have higher eligibility level for women when they're actually pregnant than they do when they're not. And so, in fact, the percentage of births in rural areas that are covered by Medicaid is 47%. We're
Wow.
talking almost half of births in rural areas. So women of childbearing age, that is, a time of great expense for families.
Yes.
And unfortunately, particularly young children, those families are relatively low income in our country. So Medicaid is absolutely essential both for moms and for children, I should say. Nearly half of children in the country are covered by Medicaid as well.
Amazing. We've really had a wonderful support system, and that's now threatened. We've been talking with Joan Alker. You can learn more about this at ccf.georgetown.edu. Joan is the executive director and co-founder of the Center for Children and Families, CCF, and a research professor at Georgetown University McCourt School of Public Policy. As you can tell, she's a nationally recognized expert on Medicaid and children's health insurance program. Thanks so much for being with us today, Joan.
Thanks so much for having me, Jonathan.
Good. Remember, everybody, you can watch us on YouTube. You can subscribe to us at our website, gotohealthmedia.com, and you can listen to us on 8 podcast networks. We'll be at 1.4 million downloads by the end of May, so thanks for your listenership and your interest. This has been Jonathan Marks with Go to Health Media, and remember, as we say at the end of every show, go to health. Take care. Bye-bye. We'll see you again next time. Thank you for tuning in this week to Go to Health Media. Be sure to join Jonathan Marks and another health expert next time. You can also catch the program on your favorite podcast platform. Until our next show, be sure to visit us on the web at gotohealthmedia.com and elevate your life.